Dr. Claytor here, welcome. This morning we're going to talk a little bit about the difference between a board certified plastic surgeon and a surgeon who is a cosmetic surgeon. It's complicated, there's no question about it. Really what it boils down to is, does your surgeon have board certification from the American Board of Plastic Surgery? If they do, then this individual has gone through rigorous training and has been board certified in plastic surgery. Cosmetic surgeons have an entirely different pathway that they go through in their certification. It's wonderful that they have a certification process, but it is not the one that is recognized by the American Board of Plastic Surgery. The big difference between this has to do with the credentialing. And the question that you need to ask your surgeon is, are you certified? Are you given the privileges to perform this particular operation in a hospital operating room? And furthermore, do they have admitting privileges at that particular hospital? Again, because having continuity of care after you perform the operation is extremely important in the overall success of the operation and the health of the patient. Because there are a tremendous explosion of surgeries that are being done in office-based surgery where you do not have this credentialing challenge. If your surgeon can perform this procedure in a hospital setting, then they are certified by the American Board of Plastic Surgery. The differences are nuanced because we are doing cosmetic surgery. But what you should really do is your homework and find out, does this individual have board certification? Does this individual have the ability to perform this particular operation in a hospital setting? Many of us have set up their own operating rooms, which is where I am today, and I do this surgery here. This surgery is the same surgery that I would do in a hospital setting, but we happen to have the facility here and the luxury of doing it in our own office-based surgical facility. But I still have the credentials to perform this operation in the hospital setting. And it goes one level even deeper because the plastic surgeons in this country who are doing the bulk of the cosmetic surgery are members of a society which is called the Aesthetic Society. And the Aesthetic Society are a group of surgeons who are focused on providing cosmetic surgery, aesthetic surgery, plastic surgery, use whatever term that you would like, but these are facelifts, rhinoplasties, breast augmentations, abdominoplasty, brachioplasty, all of these operations that patients are seeking and looking for practitioners to help them with. These are operations that are performed in the hospital, and they're also performed in surgery centers or office-based surgical facility like we have here. I understand that this is complicated, and it gets even more complicated when you go into the internet and it is a free-for-all and people are entitled to say whatever they'd like. So ask your surgeon these questions. What is the difference in your training? Where did you train? What certifications do you have? What board certification do you have? And is this board certification from the American Board of Plastic Surgery? I hope you found this helpful. Thanks so much.